Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. I'd like to welcome Doctors Pamela Wible and Dominic Corrigan. Thanks for joining us today, Pamela and Dom.
Thank
Hey,
you for
hey,
having us.
Sure,
thank you.
absolutely. So we've been looking forward to this for a while, and since we have so much to talk about, I'm going to have you introduce yourself so that you can share whatever is most important to you. To start, though, I thought I'd share that what all three of us have in common is that we're fierce advocates for physicians and for the prevention of physician suicide. And today we'll be talking about how each of you has been impacted by physician struggles, your perspectives on PHPs, which are physician health programs, and some proposed solutions. Because what we want to do is offer hope and help to doctors out there. So getting to the proposed solutions is going to be very important. So Dom, let's start with you. What would you like our audience to most know about you as we begin our conversation?
Hi, Kim. Thank you so much for having me. So I'm a psychiatrist in recovery from both mental illness, addiction, and burnout. I'm also in recovery from being a physician and all of the joy and the pain that that brings. And I'm not showing my camera because part of what we do at Physicians Anonymous is our emphasis is on anonymity. Many physicians feel that they have to remain anonymous when they're seeking help because of all the structural issues that disincentivize us from getting help, which I'm sure we'll dive into today. And meeting Pam today for the first time is a real privilege. I've been following your work for a long time, and Kim, you've just exploded onto the scene recently, and it's like you know everybody. But this is such an important piece. You know, our healers are wounded, and we need to make it safe and easy for those of us that are struggling to get help without fear of recrimination, discrimination, and all of the other negativity that's going on in the physician mental health space. Thank you.
Okay, absolutely, Dom. Thank you. And Pamela, what would you like us to most know about you?
Well, I've been running a suicide helpline for physicians for 12 years as a result of 3 doctors who died by suicide in my town, and they were all covered up. The media would not report it, nobody would talk about it. And so I was rather startled by that. I also lost both men that I dated in medical school by suicide, not while I was dating them, but when they were married, successful with children and families at 39 and 44 years old. And I've been suicidal myself, and my mother is a psychiatrist who's been suicidal. So, oh gosh, I guess I was born to do this. I have 2 physician parents who struggled with mental illness and also with parenting amid workaholism and the unfair demands placed on physicians in the workplace so that they literally are not able to ever really have a balanced life. Especially today, working 28-hour shifts, we don't have labor law protection. I just sort of self-appointed to investigate this because I wanted to know why all my colleagues were dying. And I think the culmination of this is the revelation that we sustain human rights violations as the norm in our medical education and our training. And that leads to some very poor situations and outcomes for our colleagues. So
Hmm.
yes, I would like to prevent that.
Yeah, well, me too. You three, right, Tom? All of us. And I'm sorry for the experiences of both of you. And I appreciate what you're doing to support your colleagues and to shed light on this. Dom, would you like to share any more about yourself or your journey?
Sure. So I didn't mention initially, but I've lost two close colleagues to suicide, physician colleagues. I also have a family history. We could be related, Pamela. I have a family history of all sorts of mental health difficulties, which inevitably led me to becoming a psychiatrist. And during I guess, rocky bottom, as we call it in recovery, where I kind of hit the rails, I was also acutely suicidal. And the problem with being a physician with some pharmacology knowledge and some training is that we're a very high risk for suicide. Our suicide, risk is roughly twice that of the general population, although studies vary. And as Pamela intimated, it's not well spoken about, and it's a hidden problem, but with huge devastation. I mean, one study speaks about the impact of one physician suicide impacting a huge number of patients. So it's a huge problem. The reason why I founded Physicians Anonymous with a psychology PhD was when I was in my struggles. So part of it was denial. I did not want to get help. I did not want to see that I had a problem. But then the other part of it was I was too afraid to get help. So if I'd come out of that denial, and maybe the fear was part of the denial, I don't know, but I wanted there to be another option for physicians to get help, where they could at least connect with fellow physicians in a completely confidential and anonymous space. Peer support has a strong evidence base, and it's something that's off the record. It's non-clinical. We wanted to make it super easy for people to access that peer support. It is not clinical care, and many of us do need that, and that is there's not a substitute for that, but it can be a kind of gateway into that. So if people we feel needs are not being met by peer support or coaching, then we'll strongly encourage them to get the right help. But as I'm sure we'll discover today, there are quite a lot of, shall we say, barriers in many, if not most states currently, to actually reaching out and getting that on the record help. Thanks.
Well, and thank you very much for all the work you're doing with Physicians Anonymous. And I did interview Dr. Joe Sherman, who's one of the Physicians Anonymous coaches. He was one of my first guests. So when I share this episode on LinkedIn, I'll also share a link to that episode, because I tried to ask all the nitty-gritty questions that a doctor might, if they were curious about Physicians Anonymous, but weren't sure. I wanted it to feel safe and comfortable. So even the logistics of how to actually, get started and all like that, we answer all of those questions. Joe did a phenomenal job, and Dr. Joe Sherman in that episode. And so Pamela, what else would you like us to know about your journey?
Well, I first want to thank Dom for the work he's doing, because 12 years ago, it was extremely lonely in the space. Like, you would Google this and I would be like the only one on page 1 of Google that was like, it was just really, I felt like I was a leper or something. Like, you weren't allowed to talk about this taboo topic. So I am so happy of all these people, the voices coming forward and the organizations. And I just, it's heartening, because we need a lot of help. Obviously, there's a lot of doctors suffering. And so I think it's really cool, the angle that Dom has, where people can be completely anonymous. I guess I have like the opposite with our peer support. We have incredible deep intimacy of a small, curated groups that I run on Sunday. So people all have to turn on their screen. They can't have that their screen has to be on so other people can feel safe, because they know each other. They trade their phone numbers, they stay in touch, they come every week. So the other thing that I do that I think is really important, now that I've recognized the wide variety of human rights violations that we experience, some of them come from medical board investigations and physician health programs. And so I have a special group, and we've been leading physicians through the medical legal territory of where they lack due process. I think you maybe read what I've written on this, but for those who are listening, doctors end up, whistleblowers are sent to the equivalent of like physician re-education camps where they are gaslit and can lose their lives to suicide. We have a very destructive current model for physicians who ask for help, especially if they don't have a drug or substance use problem for which the PHPs were created. They can end up there as whistleblowers. They can end up there with like postpartum depression. They can end up, for all sorts of reasons in which they are basically being held captive with bureaucrats practicing medicine without a license, which is quite dangerous. And I could go on. It's a little startling, but
Sure.
there's a lot of doctors who died there.
Sure. So, Dom, I remember reading an article where you were exploring that. And of course, like we've said, like life isn't a choose your own adventure book where you can go back and pick another choice, right? go back to the past. I know you had said that you were thinking that if you hadn't till you hit rock bottom, and if you had reached out to like a physician health program, that it might have been helpful. So I want us to present all angles of it, and I was wondering if you'd like to speak to that a little, and then Pamela can share her experiences, which are different.
Yeah, absolutely. So, I mean, just firstly, in terms of the physician well-being ecosystem, what Pamela's doing is amazing. And I think getting people to actually come out from behind that, you know, uh, behind that sort of wall of shame and secrecy about struggling as a physician and creating those connections outside of the meetings is a wonderful thing. And so I'd really encourage people to consider which one's, best for them, or maybe a bit of both, who knows. But there is a whole physician support ecosystem that is evolving out there, ranging from completely anonymous and confidential to kind of face to face. And that's kind of in the informal side of things. And coaching, for example, is exploding. And I think, again, it's a non-clinical intervention, but very helpful for a lot of people, especially around career crises and coping with some of the perhaps lighter things, that the many things that we encounter. But there are huge structural issues, as Pamela intimated, around around the damage that is done to us and the human rights violations that we undergo throughout, from training to residency to practice, and these seriously need addressing when we think about solutions. Um, but my experience of PHPs, well, firstly, if I had gotten help with a decent psychiatrist early on, if I'd been brave enough to do that, maybe I wouldn't have ended up where I did, which was crashing and burning. But it was, as I've said, fear and denial, and a bit of arrogance that kept me away from that. I was doing so well as a physician. My workaholism was, doubly encouraged. If you want something done, go to a busy person, and I just take on more and more and more. I was in a really comfortable space, but dying inside. And maybe if I had gotten help earlier, it would have been a different story. And if I'd known about anonymous groups, which I only discovered, after my downfall, if I'd known about anonymous groups and the power of that peer support, then maybe I would have gotten help. Maybe they would have then said to me, "Look, we can do this part of your getting better, but actually there's another part of you better that we can't do, and that we think you should go to A, B, and C, and get that help." So I was hoping that my kind of midlife career train crash could be avoided by providing this option to other people. So on this journey, which we've been going for about 2 years now, we started really anti-PHP based on all the stories we were hearing. And they really are horror stories of people, without substance use problems, um, but then somehow getting sort of pigeonholed under a PHP, and then they had to pay for all of this. They had to pay for their drug test, even though they don't have drug tests. There's all sorts of horror stories, which just you step back and you go, how could this be happening 2023, 24? But then, as a result of that, actually, a couple of PHPs reached out to us and said, "Hey, hang on, are you disincentivizing and frightening people?" And we were like, "Well, what is the truth?" And what we understand is that really depends on the state that you're in, how compassionate the PHPs are. So we've spoken to two that are incredibly sound anyway, and I've not been through their process, but they sound incredibly positive, and compassion focused. One is actually led by a physician themselves in recovery, so who's kind of out there, and staff know that, to treat the physicians well, because one day they might be their boss, right, in the PHP. So it really is variable. It's almost a lottery as to which state you're practicing in, whether you're going to get compassion focused care or punitive care, or somewhere within that spectrum. So what we need is consistency in terms of, what is the paperwork that they require? In other words, how much of a disclosure do you have to give in terms of what care you've been given and prescribing and so on. But then there's also, where's the cutoff for being seen by a PHP? Where's the nationwide standard for who needs to see a PHP and who doesn't. You know, many people, mild conditions, do not need to see a PHP. They could be very happily treated with some cognitive behavioral therapy, or you know, other lower level interventions. In addition to things like peer support, the stuff that Pamela and I are offering, because I think it's important to get that physician perspective. Not everyone needs a PHP. And so, yeah, and what happens when people are wrongly referred, you know, for example, whistleblowers, you know, they don't have a mental health issue.
Right.
They're speaking out against a toxic system. And yet what defense do they have? So I think it's a complicated picture, and it really needs a high level kind of solving to be consistent across all the states. And I'm not sure we have the answer to it here and now, but the principles would be around, you know, human rights for physicians, equal and fair treatment, and there being no barriers to getting help. You know, if I've got a broken leg as a physician, I have no fear of going to an orthopedic surgeon. But if I have depression or anxiety, currently, most people I speak to, at least in the circles I'm in, are fearful of reaching out for psychiatric help for the implications on their career, and on their registration and their credentialing and so on. So I'll pass there.
Okay, yeah, thank you. Dom, I do want to ask you one more question. Is there any way to find out which states, like the ones that you talked to that sound good on paper anyway and sound supportive, is there a way to find out which are the better ones?
That's a great question. I believe that a database is being developed. Maybe Pamela is better than me, but I believe something is being developed about with all the different criteria. But I do not know how. This is something that we actually suggested in our discussions with the PHPs, is like, you know, how do physicians know? You know? But then there's another level, which is, if a PHP is particularly punitive, then why would they say that? Do you know what I mean? So,
Yes.
and many of them are funded by the physicians themselves, and so they'd be doing themselves out of business. So I'm not sure that it can be something that relies on the individual PHPs. It does need a higher level approach for consistency.
Right. Okay, thank you. And I will share, last summer I compiled a list of free and confidential resources for physicians. So I will share that when I share this episode. And then I'll actually send both of you the list when we're done here. So if you have other things to add, because it's likely not a complete list. So Pamela, feel free to respond to anything Dom said. But my other question is, this is not the same as an employee assistance program.
No,
Right,
it's
so
not.
do you
The
want to like
problem,
share the distinction?
yes, well, the problem is that these are state sanctioned, and that they claim it's voluntary and confidential. It absolutely is not, because if you want your license, you have to do everything they say when you sign on the dotted line. And this is very different than what anyone out there would consider, like anyone, you know, who needs mental health care for depression or whatever. You know, if you were to go to somebody and you didn't get along with them, bad chemistry, whatever, you could always fire them and go somewhere else. The problem with the PHP, you can't fire them. You can never get out of it. Once you're in, you're in. If you don't do everything they say, and they use, you know, non-FDA approved laboratory tests, and one of their labs just got shut down because of insurance fraud. So they use very slick, underhanded methods that are absolutely methods that would not fly in like the civilian population outside of just this. Basically, it's like you're guilty until you're proven guilty. You will sign on the dotted line, or you will not practice medicine. And once you sign, you can never get out. So that's really the problem. There's no informed consent. No, I don't think anyone would ever sign up for a primary care doctor or surgeon or whomever, knowing that you could never fire them. You could never get away. You're going to be duct taped at the hip for 5 years, and then you're going to be monitored. It's very dangerous, actually. And so the thing that I would want to bring up to Dom is, if you're getting your information from people within the PHP that are funded by this, and by the way, as far as monitoring all the different states, they're trying to monitor themselves and create like sort of an accreditation, but within their own system. There's no external oversight. This is like a forensic exam, meaning like what a criminal would get. The doctors that are there are treated like criminals, and they do not have the right to leave the PHP. And if they want to leave the PHP, they will never practice medicine again. So this is very serious. And I think and it's startling. I know it's very startling to people to hear this, but I think not many people truly understand what it's like unless you've been there yourself as a victim. It's kind of like trying to explain to people what a Granny Smith apple tastes like. You know, we could have a million podcasts on it, but until we bite into an apple, we're not going to know. And I've spent just unbelievable numbers of hours with physicians, including physicians who've taken secret recordings during their polygraphs. I have all sorts of secret recordings from inside these facilities. They're extremely dangerous, in my opinion, for anyone that wants to have the right to choose another course of action. And also, I mean, they just use completely non-standard methods. I mean, can you imagine going to a psychiatrist and then being put through polygraphs every 3 months? I mean, they do things that are absolutely unheard of and considered against all standards by the American Medical Association and any sort of ethical, and it's really quite a nightmare, even for people who do have substance use issues. So I think the main issue is there's really no true informed consent going in, so people don't understand this is more like forensic, and you are captive and you can't leave. You can't just say, I'm not going to do this, because you will lose your license.
So before we go back to Dom, can you please just clarify and share with people what the employee assistance program is? Because I've spoken with doctors who were suicidal, who were helped by their employee assistance program. So I want to make sure that there isn't a cloudy and gray area, and that people know how the employee assistance program differs, so that that is one option that they can reach out to for help. Pamela, you could speak.
I'll just say, I think, just FYI for anyone listening, I think it's very unwise to ask for help through your employer. This is your personal business and should never be wrapped around a medical board, your employer. This is, if you want to take ownership of your health, you should do that outside of your employer, and it's your own personal business. And what's really disturbing to me is that when we sign for a medical license in most states, we're signing away our HIPAA rights, which is really terrible. We're giving away our privacy and confidentiality just to have the privilege to practice medicine. And I really feel like physicians should be protected by the same laws that everyone in the United States, like in the ADA and labor laws. Like, there's certain things that everyone benefits from by living in the United States, to protect them from dying at work, called labor laws, and their disability rights and such. And so physicians, unfortunately, don't enjoy those. And so that's what puts us, that's why we're dying by suicide, because, just think, if you work 28-hour shifts, that's not healthy. That could throw your whole system off. That could throw you into sleep deprivation psychosis. I've known several cases of that, right? And hallucinations, right? And then on top of that, if you ask for help, what I want to make really clear, when physicians are asking for help, they're often asking for help for the mental health conditions they're developing from occupationally hazardous working conditions. So this is all a very unsafe environment. So to kind of, like, I put it this way, to ask for help from the employer that wounded you with the 28-hour shifts, that's a little bit like going to your rapist's house asking for counseling. You're not going to get counseling that's really going to work from the entity that actually injured you, or any associated entities that are actually financially benefiting from your injury. I mean, I know it's startling to hear this. It's just the truth of what I've witnessed for 12 years.
Okay, Dom, you can pipe in with anything that you'd like to add, or any thing more you'd have to say about proposed solutions.
I mean, I've only been doing this for 2 years, Pamela, and I've heard similar horror stories about human rights abuses. And there needs to be external quality assurance, and there needs to be a standard across all the United States. You know, I appreciate that there's state level contracts and legislation and so on, but we actually need a federal approach to this. And I'm going to talk about deep dive into some solutions that I found in a minute, but um, I just want to say that I have also heard on the other side, I've also heard, and I appreciate that there is a selection bias. The people that come to our meetings are people, that have already, often been damaged through PHPs and so on. But I have also heard stories of people benefiting from them, and these were people with substance misuse problems where and this is where the PHP sprung from, was alcoholic and drug addicted doctors who needed the structure and the expertise and so on, and the testing, and actually physicians do really well, generally speaking, in addiction kind of rehab, better than the general population. That's what the studies show us. The problem is these systems have now been copied and pasted for other difficulties, and as Pamela says, certainly addiction is very commonly, as a result of trauma, and we see again and again. I've not met a physician coming into our system, into our meetings, who said, "I don't have a problem at work. My depression or my anxiety or my trauma is entirely unrelated to my being a physician." Every single one of them, and some of it is the blood and guts of medicine itself. Some of it is the moral injury that we sustain from being in systems that are under-resourced for the demand. Some of it is administrative problems related to financing, related to insurance, related to health records. There's a lot of cultural issues around hierarchies and abuse of power and bullying. I cannot believe that in this day that we're still tolerating the kind of ridiculously long shifts and the kind of mistreatment stories that I've heard from multiple residents in multiple countries, not just the US. We're still letting this go on like it was 100 years ago. We need to have legislative protections, and they're all there, but we need to be included in them, and maybe even some specific ones actually for healthcare practitioners. I think other healthcare workers have similar challenges, but I'm not sure exactly which are not protected by the Americans with Disability Act and so on. But for example, if you 20 years ago got a course of cognitive behavioral therapy or a course of Prozac or something for a mild depressive or anxiety episode, that could be used against you in some states, many states, in discovery during malpractice litigation. So I've heard this story where that the doctor's then state of mind gets called into question because they had a depressive episode, X number of years ago, and they got help. They're perfectly healthy. They're a brilliant doctor, but it's resulted, it's used against them. So we need tort reform in addition. We need to have protection for physicians. I've heard horror stories of physicians being sued, 20 years down the line for something they did during an obstetric, during a normal childbirth or difficult childbirth or whatever. And they've been sued and had millions against them for a condition that is completely unrelated to the childbirth. However, the jury decided against them. So in that particular state, there is no sense check of does this even have medical validation, what this patient or ex-patient is alleging, and their attorney. So there's so much inconsistency from malpractice through to how you look after doctors, through how you train doctors, through how you support your own staff. When you're employing, these highly qualified, hardworking people. It's a really complex issue, but it does need a very high level, consistent, federal, in my opinion, approach. And I'll just very quickly say, so I looked in other countries, and I think the shining light is actually in the UK, which is where I trained. The National Health Service has a single practitioner health program, which is free, confidential, primary care, for addiction, and it liaises if necessary with the regulator, but they're also, they're clinically focused, but they're all, they're about safely returning to practice. They have no skin in the game, whether you stay in or not. In fact, it's better if you get better and get out, because they don't get paid if you stay in and pay for extra drug tests, etc., etc. So
That's excellent.
essentially
Right.
funded, completely independent system that is consistent across all parts of the United Kingdom. That is what is available to physicians there, and they don't have the same statistics. I can't find the same statistics, but it looks like their suicide rate is lower than ours in the US for physicians. Although they still have a problem with physician suicide, it doesn't seem to be on the same scale as ours, and that I think is one of the issues. They're not immune to the stresses of COVID, of lack of resources, and all of the other stresses that are common in most healthcare systems. But how they care for their doctors, I think, is something we should really look to for inspiration.
That's really an excellent point, because the financial conflict of interest is a huge problem. When people go in, Kim, to these PHPs, they often are charged, like $7,500 for a 4-day evaluation, which, by the way, other people outside of physicians are not beholden to a 4-day evaluation. That's not how you get substance use treatment. Nobody's locked into so this is something unique to physicians. That's a real moneymaker for PHPs. And then, inevitably after your 4-day evaluation, especially if you're a whistleblower, like all your tests are clean, you don't have any drugs in your urine, well, they'll find something else. They'll say you have marriage problems. With this particular gentleman that I'm talking about, his return to work order included his wife going to marriage therapy. I mean, can you imagine working at Starbucks or just anywhere? In order to get your job, your husband or wife now has to go to therapy for you to continue working. That's just absolutely ludicrous. And polygraphs, and so I think it's just really important that we remove the financial incentives, because a number of physicians who've reached out to me who were sent to these programs, they couldn't participate because they didn't have $60,000 in cash, $100,000. They just finished their training, and then they have a whole financial aid department. Well, they'll say things like, "Well, isn't your career worth $100,000?" And they'll even ask them, "Don't you have a wealthy relative? How much? Let's look at your house. What do you have left?" I mean, this is financial extortion at that level, which it sounds like doesn't exist in the NHS system. So that would be a good model. You take the profiteering off of vulnerable doctors who've been injured by just being doctors out of it, then you can truly get care, which should be in all cases. I think, Dom and Kim, we can all agree every person deserves informed consent, before a surgery, before seeing somebody, to know that you could get a second opinion on your own that's truly neutral, but that's not allowed in the PHP.
Right. Well, then thank you
Yeah.
for sharing that. And since we want this to offer hope and help to physicians as we wind down these last couple minutes, what would you like to say, Pamela, as far as offering hope and help, and what can and should doctors do?
Well, I absolutely agree with Dom. This is something that needs to be looked at the federal level. And thank God we have the Department of Justice involved. 3 senators, 2 from Oregon and 1 from New Jersey, wrote a demand letter on February 23rd last year, demanding that the DOJ investigate PHPs and medical boards in hospitals and residencies for violating the rights of their their staff and students. And I sort of felt like called into this because 25% of that letter was direct quotes from my research. So I felt like I needed to do something. I couldn't just kind of sit back and hope that the DOJ figured this out on their own. So I'm happy to announce our support group. I've helped a number of people, and they're write their letters to the DOJ, because see, we can't get the legal help we need until we actually file the complaints with the details of what's gone wrong. And so 7 people in our group have had follow-up interviews with the top attorneys at the DOJ, which is awesome. So we're getting federal attention. And then, of course, I have a 24/7, while I'm awake helpline that's free that anyone can call, and we can talk for hours in the middle of the night. And I hear from nurses and doctors, and it's not just doctors, it's everyone in healthcare needs somebody to talk to. And then I have these 3 support groups that run every Sunday, as well as a free group on Sunday. So anyone who has any problem, please reach out. Although I will say, I'm not anonymous, it is me, and you can't put your screen on black because we need to know who you are, especially in my group that supports PHP and MedBoard injured folks, because I don't want any moles in there that actually work for the PHP or the MedBoard coming in to spy. This is why I really take it very seriously. And I really have to vet people out before I let them in that particular group, because I don't want to put anyone in there at risk of somebody recognizing them and then using what they say against them.
Okay, well, thank you. So, Pamela, you can send me a list of all the ways that people can reach out to you, and I'll include that in the show notes and when I share this episode on LinkedIn. And Dom, what are the ways that you'd like to know, you'd like others to know that people can reach out to you?
Sure. So check out physiciansanonymous.org and you can see our resources there. We have a live global suicide reduction resource database. So every country we've been able to find for physicians, you should be able to look up your country or your state or your region and look up, resources that are available in your area. We're 90% US, but we have people from all over. And book into any of our online meetings through our calendar link. They're free, they're anonymous. The funny thing is, right, people start with their fake names and their screens off, but within 2 to 3 meetings, over half of people are screens on and full names. And so trust is built and community is built. And the number one message we hear is, I wish I'd known about this. I wish I'd known that I was not alone. Because we suffer in silence and we're not alone. There are 61% of us, according to the latest Medscape survey, who have got signs and symptoms of burnout, right? That's 61% of nearly a million physicians practicing in the US. That's a large number. We are not alone. You are not alone. So reach out for help. There are any number of resources. Find the one that's best for you. And try it out. And if it doesn't fit, then try another one and keep going until you find the one, because there are lots of people that have been where you've been and have come through the other side as well. A few years ago around the time of COVID, I could have ended up dead, and I didn't if it weren't for amazing peer support and a great therapist and some good meds. And I'm here to do some good work. And every one of us could be there. Suicide is not the answer. It is it's a permanent problem to a temporary situation. And we really, if you're feeling like that, reach out to somebody, anybody. And I just want to shout out to the Lorna Breen Foundation as well for the amazing work that they're doing in terms of getting the state medical boards to change their intrusive language from licensure. But yeah, we need to have a much wider approach, and I hope we can continue this conversation soon.
Absolutely.
And one quick final comment is, I want to tell patients and everyone out there, thank you letters to your physicians have prevented suicide. So just show your love, say thank you, give a thank you note. If you're a colleague, say thank you, tell people you appreciate them, and that has saved a lot of people from suicide.
Yep.
Absolutely. Well, thank you both, and I appreciate you. And I'll see you on LinkedIn. And
Thanks,
I
Kim.
can't wait to share this episode. You both take good care.
Thanks, Pamela.
Thank you.
Bye.